Magic 61 presents In the Medicine Cabinet, a look at medicine and your health with UCSF pharmacist Dr. Linda Bernstein.
Good morning, and thanks for joining me in the Medicine Cabinet.
Non-prescription diet pills. Do they work, and what are their risks? Hello, I'm Dr. Linda Bernstein, your consumer pharmacist. Many over-the-counter products that claim to decrease appetite contain phenylpropanolamine, or PPA for short. The effectiveness of PPA as an aid in weight reduction is uncertain. Overuse can cause nervousness, insomnia, rapid pulse, headaches, and nausea. Some patients have experienced an acute rise in blood pressure even with average doses. Do not use PPA-containing products if you have high blood pressure, heart or kidney disease, hyperthyroidism, diabetes, glaucoma, or depression. Successful weight loss requires a change in eating and exercise habits. Reduce calories, and particularly cut down on fat. Bake or broil instead of fry. Use lean cuts of meat. Cut off visible fat and eat more fruits, vegetables, and grains. Use low or non-fat dairy products. Exercise is also important, but check with your physician to find out the best type for you. Diet pills should be looked upon as a temporary aid at best. Limit the use of diet products containing PPA to 8 to 12 weeks. Do not take more than the recommended dosage. I'm Dr. Linda Bernstein, your consumer pharmacist. How long does it take for a poisoning to occur? The answer is seconds. That's all it takes. Hello, I'm Dr. Linda Bernstein, your consumer pharmacist. Yes, seconds is all it takes for a poisoning to occur. In the time it takes you to answer the phone or throw in a load of laundry, your young child could eat the contents of an aspirin bottle left on the bathroom counter, swallow detergent stored under the sink, or take a bite out of a poisonous plant. How long does it take to prevent a poisoning? The answer again is seconds. That's all it takes. It only takes seconds to secure the safety cap on medicine bottles, store medicines and household products in a hard-to-reach locked cabinet, and put them away after use. Discard poisonous plants. Keep insecticides and other poisons in their original containers. It only takes a few seconds to explain to children that medicines aren't candy. They should never take medicine by themselves or give it to others without your permission. Keep a bottle of syrup of ipecac on hand to induce vomiting if directed to do so by the Poison Control Center. Post the number of the Poison Control Center by all your phones. Children act fast, and so do poisons. Take a few seconds to save a life. I'm Dr. Linda Bernstein, your consumer pharmacist. Travel is often associated with eating foods and drinking beverages that are a bit more on the exotic side. More desserts, more sauces, fried fast foods, and spicy dishes, more alcohol or caffeinated beverages. We tend to eat out more, so we have less control over food choices and preparation. We also tend to snack more because meals are scheduled at odd times. The result can be an upset stomach, changes in bowel habits, and unwanted weight gain. Here are a few tips for eating wisely and in moderation when you travel. First, try to eat lightly and include grains, fruits, vegetables, dairy, and protein sources in your diet. Minimize your intake of fried foods and other high-fat foods. Make the words "sauce on the side, please" a regular part of your vocabulary. Ask about low-fat alternatives on the menu. Drink at least 6 to 8 glasses of fluid daily unless directed otherwise, and more if you're exercising heavily or in hot climates. I'm Dr. Linda Bernstein. Go in good health.
Love, it's love, it's love that makes the world go round. It's love, it's love, it's love that makes...
Love does make the world go round, but sometimes love is not enough, as many new parents face overwhelming challenges in the earliest years of their child's life. And these years are the most critical for the child's social, emotional, and cognitive development. Yet last year, more than 1 million children were abused or neglected, and 3 children died each day as a result of maltreatment. What can we do about child abuse? One solution is Healthy Families America, a volunteer home support program that promotes positive parenting from the time the child is born. What is the most preventable cause of death in the United States? The answer is smoking cigarettes, and it's a major risk factor for cancer, heart, and lung disease. It's addictive and expensive, so stop smoking because you're worth it.
This is KPIX Eyewitness News at 5.
Good to have you with us again, Linda.
Nice to be here.
The drug that everyone's talking about, phenylpropanolamine, otherwise known as PPA, It's been on the market for quite some time. How does it work, and why is it in all these pills?
Well, one of the unique properties of PPA is that it suppresses the appetite. That's really the main way that it works. And that's the reason that it's put in so many different products. In fact, there's several hundred products on the market, including cold preparations that contain PPA. But the ones we're most concerned about today are the diet pills. And with that, there are about a dozen different products that have PPA exclusively, and then another 6 or so that have it as a combination.
It's 16 minutes before the hour. Americans get 1.5 billion prescriptions filled every year. For the most part, it's pretty simple. You just pick up the medicine and read the label. But according to the New England Journal of Medicine, there's a lot more that you should know. Linda Bernstein is a consumer pharmacist at the University of California, and she's with us this morning. Good morning, Linda. Now, aside from being able to read the doctor's handwriting, which is something that a mystery that most of us cannot crack, what is it that the pharmacist can do for us that most of us haven't been taking advantage of?
Well, I think that's the key point, is that people haven't been taking advantage of the many valuable services that pharmacists can provide. And one thing you should do is get to know your pharmacist so they can know your medical conditions and all the medications that you're taking. And that way, you'll already be one step ahead.
Kick off our week-long Good Morning America series, Travel Without Reservations, Tips for a Safe Vacation, we have some advice you can pack for an accident-proof trip. Joining us now is the author of the book, The Family Vacation Health and Safety Guide, Dr. Linda Bernstein. Good morning.
Morning.
Dr. Bernstein, in your book, you emphasize plan ahead. What should we consider before we even leave the house with our family?
Well, Willow, you're absolutely right about wanting to maximize fun and minimize the time you have to spend in doctor's offices and emergency rooms when you're on vacation. So a good way to start planning ahead is by having a pre-trip physician visit so that you can discuss your itinerary with your physician and make sure that nothing you have planned would harm your kids in any way. That's sort of step one. And also what's a good idea is to go over the medications that your family may be taking. Make sure that they're only taking what they should and are using them properly. Make sure you've got adequate supplies and know how to store your medicines while on vacation as well.
Knowing the facts about your child's medicine and how to properly administer it may save your child from harm. And here to tell us what we should know about medicine and children from the Safeway Pharmacy is Dr. Linda Bernstein. Hi, Dr. Linda.
Great to see you.
Always nice to have you back. This is the kind of information that we can all use with our families. And, you know, there's no way of avoiding it. Our kids are going to get sick.
That's right.
But what we can try to avoid, of course, are these medication mishaps. And there are quite a few of them, as I understand it.
That's right. I don't know if you realize this, but over 200 million prescriptions are written for children each year in this country. And about a third to a half of those are used incorrectly.
All coming up next on Health Network 2000.
Hi, I'm Dr. Linda Bernstein. Welcome to Health Network 2000, presented by Safeway Pharmacy. Today we've got a healthy dose of fun, facts, and fitness for you and your family. Later we'll tell you how to sign on to our website for more details. For the past 15 years, Americans have been told to reach for the carbohydrates and push away the fats. Today we're eating less fat than at any time in our history, and that's good. But the battle of the bulge is still alive and well. Are we overloading on those morning muffins? Are we choosing the right kinds of fats? Is the zone diet the answer? We visited Bay Area health advocate Joni Greggins to find out. Well, there always seems to be another diet on the market that we hear about. What about the zone diet? I'm seeing it on the internet, books. What's going on with the zone?
Well, it's bringing back protein.
Pharmacists are consistently rated the most trusted professional, and yet they're often underutilized. So get to know what your pharmacist can do for you and what you can do for your pharmacist. Taking medicines isn't always easy, but your pharmacist can help, and so can you. So let's find out what your pharmacist can do for you and what you can do for your pharmacist. The most obvious pharmacy service is filling prescriptions. Most people think that's all we do, but it's only the beginning. Pharmacists are highly trained health professionals that can help ensure you're getting the right medicine for the right condition in the right way. So take advantage of this. Pharmacists also provide medication counseling. Pharmacists can talk with you about your medications to make sure you're using them correctly and help if you're having any medication use problems. Drug interaction screening. Pharmacists keep an up-to-date computerized medication record with information provided by you and your physician to screen for potentially harmful drug combinations and point out drug duplication. Medication selection. They can provide information to help you select non-prescription products, or if needed, suggest that you seek treatment from your healthcare provider. They can tell you if a generic version of your medicine is available to save you money and discuss with your healthcare provider if it's right for you. Demonstrate how to use a medication. The pharmacist can provide special instructions on use of medicines such as inhalers or blood glucose monitors. Provide written information. Your pharmacist provides written instructions both on the bottle label and as a longer format information sheet. Drug delivery. If you're housebound or take care of someone who is, ask your pharmacist about home drug delivery. Provide healthcare screening and other services. Pharmacists provide opportunities for health screenings such as routine blood pressure monitoring and flu shot programs. What can you do for your pharmacist? Stick to one pharmacy. Get to know your pharmacist so they can become aware of your medical conditions and medication history. That way, the pharmacist can keep track of all your medicines. This is particularly important if you see more than one physician. Have a brown bag session. Gather all of your medicines in a brown bag. Review them with your pharmacist every few months to make sure you're using them properly. Mention any allergies or adverse drug reactions you have had. Ask questions. Don't be afraid to ask about your medicines. Remember, your pharmacist is there to help. Just ask. For more information on what your pharmacist can do for you, check the Health Network 2000 page at www.safeway.com. If you tuned in late to our show, there'll be an encore presentation next Sunday on Bay TV. Otherwise, we'll see you next week here, Sunday afternoon at 3:30 on Channel 4. Well, that's it for today's show. For Safeway Pharmacy and all of us at Health Network 2000, make every day a healthy one.